Hey, Emily. I hope you're doing well. I was very happy to hear from you, and I was very happy to look over your personal statement. And I thought we'd do it this way. I set up a little Zoom thing here, and I'm recording this, and so you can watch the video. So let's go over your personal statement. So I'll share it on the screen here. Okay, for the most part, I thought this was very well done. Um, I like the examples that you gave. I think it probably hit all the different notes that they would probably be looking for in a personal statement. My main comments or revisions pretty much have to do with, I don't know, word choice and maybe tightening the writing a little bit here and there. There are some places where I think you could cut a few words here and there. I know you're under a word limit situation. So there are some places where I think you could cut a few words. And then if you cut a few words, and I think there are a couple of other places where you could probably add just a little bit more specific detail here and there. So I'm thinking that if you cut a few words here and there, it'll leave you a little bit more words to maybe tell a little bit more or give a little bit more detail in other places. So those were really the main comments I have. I thought it was well organized. Like I said, I think it probably covers everything that they would like to see. So I'm kind of looking at it from a grammar perspective and so on. So let's go through this. I highlighted some things to kind of remind me of what I was going to say. I liked how you started with your personal experience, your anecdote. I thought that was really fine. And you jump right into it. You don't waste any time, and I thought that was good. A couple of things. I noticed later on when you talk about Sarah, you give her a name, but you don't give the resident in the home, in the nursing home, a first name, and I think you should do that because I like that. It's a personal touch, and then you're not just referring to her as the resident throughout the whole paragraph. It makes it more personal. So I don't know what her first name was. I'm just going to give a name. Let's say it's Anna. So here's where you could cut some words and also make it a little bit more personal. I entered a room and instantly noticed strange mumbling coming from one of the residents, from Anna, comma, one of the residents who I knew well, instead of I had become very familiar with. I would just say I knew well. That implies that you get to know your patients and you got to know the residents. They weren't just, faces to you. So that would be the first revision. Give her a first name. I entered a room and instantly noticed strange mumbling coming from Anna, comma, one of the residents I knew well. As I began to speak with her, I noticed that she had trouble forming her words and spoke about ideas that did not make sense to me. That's another wordy phrase that I would condense or cut and instead maybe give a specific sort of detail about something strange that she said. So, and spoke about, I don't know, whatever, flies on the wall or whatever sort of strange thing that she said that gave you kind of gave you an indication that something wasn't right. So when I read ideas that did not make sense to me, I can't picture anything, or I don't know specifically what that's all about. So in a phrase, be specific there if you can. You don't have to give me 5 more sentences about it, but what sort of things was she talking about that made you feel like something wasn't right? The next couple sentences work pretty well. Understanding the abilities and limits of the residents that I work with allowed me to identify Anna's unusual behavior, instead of the unusual behavior of that resident. That's wordy and it's kind of impersonal. So give her a first name and then you could just say, I was able to identify Anna's unusual behavior. I was able to quickly report her stroke symptoms because of the knowledge I gained from the STNA course. And here's something else I highlighted, and my personal experiences with my grandmother. Now, this is the first and only time you make references to this, and I'm not really sure what that means or how that connects to the experience with Anna. I keep calling her Anna, I don't know why. But if you're going to bring up your experience with your grandmother, at least explain the connection. And again, you don't need to give me 3 more sentences. You don't have time and space to do that. But it seems like you brought that up and then you just sort of drop it. So you might say, at the very least, you might say something like, and my personal experiences with my grandmother, comma, who also, suffered a stroke, or who also showed similar symptoms, or something. So again, if you're going to bring up what you learned from your grandmother, then tell me a little bit more about it. Otherwise, I might cut it. I might cut that. Because it's like something you bring up as if we know what you're talking about, and you never go on to explain it. So that would be my comment on that. Then when I returned to the nursing home later that week, I was grateful to discover that Anna, don't call her the resident, call her by her first name. Anna had received the treatment that she needed. And I would add something, another couple of words here, and was doing fine, or was much improved, or something. Tell us a little bit about the outcome. Hopefully there was kind of a happy ending. So basically you're saying is because of my observations and my quick action, she was able to get the help she needed, and it was improving and is doing well. So give us a couple words on that. So don't just tell her she received the treatment that she needed, but and was doing fine, or was much improved, or was feeling better, or give us the outcome, because that must have made you feel really good. The fact that you were skilled enough to recognize something was wrong, and you alerted the proper people, and they helped her, and she's better. And then the next sentence, I think you need a little bit more of a transition here. I would say something like, at that time, comma, though, let's see, how would I do this? At that time, though, I knew I was still limited in my abilities to help her. All right, so it connects a little bit better with the previous sentence. So you're saying, I had certain skills that recognized something wasn't right, but I still knew, I knew I was still limited in my abilities to help her. So I knew I needed to, make the next step, or have more training, etc. So give us a couple extra words there. At that time, comma, though, comma, I knew I was still limited in my abilities to help her. And then that would transition nicely into the last 2 sentences in that paragraph, where you say, now if I were a PA, then I would be even better able to help people in that kind of situation. Okay. The next paragraph, providing care to the residents at the nursing home gave me a purpose that I've always searched for. I can think of countless times, or no, I would say I can think of countless examples when I felt truly touched. So examples of times, here's where you could cut 2 words. Just say, I can think of countless examples when I felt truly touched. By the stories who gave to you. I was a little unsure about this. And don't say given to me, make it active. So I would write, when I felt truly touched by the stories and advice so-and-so gave to me. So are you talking about fellow workers, or I'm not sure who gave you the stories and advice. So I would make that more specific and rephrase it, make it more active. I felt truly touched by the stories and advice blank gave to me, or by the times that I felt I could help. And that, the rest of that sentence is really good. The listening ear, the friendly touch. I like the personal touches here. That's my favorite part of your personal statement. I know there are some parts that you have to be a little bit more formal and official, but I liked, you know, the personal touches, because it's a personal statement. So there you go. All right, the next paragraph is where you talk about Sarah. And I would just say one of these residents was Sarah. You don't need to say name. So that's one word you could cut. And then I don't know if this is appropriate or not. Since you're in the field, you could better tell me this. So I'll leave this up to you. But when you say a woman who had a diagnosis of multiple sclerosis, I would be tempted to just say a woman with multiple sclerosis. Now, but again, I'm not sure if you have to be more official and actually have to mention the fact she was diagnosed with this. But it just seems to me you would just say a woman with multiple sclerosis. And so you could cut about 3 or 4 words doing that. Due to this disease, Sarah was a quadriplegic who required assistance. And then you mention everyday tasks, and then a couple of sentences later you say things. And again, you know, you might at least once, either when you say everyday task or when you say things, you might give an example: accomplish everyday tasks like such and such, or accomplish things like such and such on her own. Just again, to make it a little bit more specific so we can actually picture something. Because everyday tasks, I'm not sure what that means. Things, I don't know what that means, unless you maybe give an example of one of those. Of all the things I learned from my time spent with Sarah, I think the most important is that make this active instead of passive. Instead of saying should be possessed by workers, say this: I think the most important is that workers in any level of healthcare should possess compassion and empathy. So I would rephrase that a little bit, make it active instead of passive, and I think you save yourself a word or two when you do that as well. All right, I learned that on the days that were, well, I meant to highlight this and I didn't, difficult for Sarah, not hard. On the days that were difficult for Sarah, or the days she wanted to reminisce, often, I would say often, not oftentimes. I don't think you need to say oftentimes. Often the most help I could, and I wasn't sure about this, I'll leave this up to you. The most help I could be is a little bit awkward. I might say the most help I could offer was to listen. I mean, I think it's okay grammatically, but that just struck me a little bit awkward, so I'll leave that up to you. And show her that I cared through the touch of a hand and a smiling face. Again, I like that. That's the personal part of the statement that I really liked. And then here you get a little bit more official. Here's where you describe your experience shadowing, Katie, the PA. And I thought this worked really well. And you do want to share the fact that you do have some experience working with a PA, and you know what PAs do and so on. I thought that paragraph worked fine. Also, I don't know if they do this in personal statements or not. It just occurred to me as far as formatting goes, but I noticed you did not indent a couple of spaces before each paragraph beginning. And I don't know whether or not that's consistent with a personal statement or not. But I'll call that to your attention. I'll leave that to you to figure out whether you want to change that or not. So I thought the paragraph about shadowing Katie worked well. Then you use the term satisfaction twice here in this paragraph. And I would be inclined to keep it here. I have witnessed Katie's ability to work efficiently with her team to provide the patient satisfaction that I so highly value. That's a good way to end. But I think here, I might use a more personal word. Satisfaction seems like such a, I don't know, official sort of word. it doesn't really have a lot of emotion to it. I was very, well, by the way, you should probably cut very. You don't need to say very. I was inspired by, I don't know, the gratitude felt by the patient. Well, I don't know, the healthcare team wouldn't feel the gratitude. I was inspired by the gratitude felt by the patient and the patient's family members toward the healthcare team after a successful surgery. I don't know, it was just the repetition of this word, and I wasn't crazy about the word anyway, and to use it twice, that kind of caught my attention. All the rest of this is fine. You know, this is talking about, you know, what you learned by observing Katie. So that's good. That's good information that you would want to include. And then your conclusion. I will remember these experiences that have, I was going to highlight this and then I forgot. Develop my passion. I might use a stronger word, maybe have inspired my passion to become a PA. And then I love the, you know, I love that you use the word empathize, because I think that's one of the main things you're trying to put across here. And I think you do it really well. You're trying to put across the idea that not only are you, well, you kind of list your, you list your other strengths here: strong work ethic, determination, and desire to learn, and all that's great and wonderful. But you know, I think your ability to empathize is that special something extra that you have that maybe others who are applying for this job or this position may not have. You know, they would like to think anybody applying for this position has a strong work ethic, determination, and desire to learn. But I think what's setting you apart is the fact that you empathize with the people that you work for and work with. And you want to further your training so you can do an even better job of caring for them. And so that's really what this is all about, to be able to continue and become a PA and to, you know, even better serve your patients, et cetera, et cetera. Bringing along more expertise along with the empathy that you bring as a person, as Emily Garrett. So I think that's good that you kind of set that apart. In fact, I don't know, that last sentence, I don't know. It's fine. You know, it is kind of you tooting your own horn at the end. You know, I have a strong work ethic and determination, desire to learn. I guess that's fine. I guess that's as good a way to end as any. You might think of a stronger way of ending it. I can't think of one right off the top of my head. It sounded like from your email that you have some time to work on this. It's not like it's due tomorrow or whatever. So the last thing I wanted to tell you is I'd be happy to look at any other, you know, revisions. So after you work on it some more, and if you want to, you know, send the revised one to me, and with other questions or you know, if you want other suggestions or whatever. I don't know, after you make all the changes I'm suggesting, I'm thinking you'll still be under the word limit that they give you. But those are my suggestions anyway. Like I said, I was very impressed for the most part with your personal statement, and my comments were really more like, you know, using one word instead of 4 here and there, and maybe a more specific or more personal word choice. The thing that I really thought about after the first time I read it, and I read the part about Sarah, first thing that I thought of was, you know, she didn't name the person in the nursing home. And that would make it so much better if you did that and just call her by her first name. So anyway, all right, so I will save this video and then obviously send it to you. So you should be getting this. I'll send it by email. And like I said, if you want me to look at further drafts of this, I'd be very happy to do that. If not, then at least keep me posted. Let me know what happens. I wish you best of luck. I would hire you in a minute, or I would certainly, reading this, I would certainly want to, you know, meet with you and give you the job or whatever it is you're applying for. Okay, so yeah, keep me up to date. And again, if you want to send me something, you know, an updated draft for me to look at, I'd be glad to do that. All right, so I hope that helped. And again, it was great hearing from you. H-Class forever. You know, you never leave Shanks H-Class. You are a member, you're a lifetime member. You can't leave. It's kind of like being in the mob. You know, once you're in, you're always in. And H-Class people are always the special people in my heart. So I was glad to help in any way I could. All right, so I'll let it go for now. Obviously, well, at least let me know that you received this email and you received the video and you got it and you saw it. So let me know that it worked. Otherwise, I'll try something different. But I think this should work. Okay. All right. Well, have a great evening. I'm doing this in the evening, but whenever you happen to watch it, have a great day. And we'll talk to you later. Hopefully we will. Keep in touch.